seeds out of everything, bagels, muffins, you name it.
Oh, yeah.
All because I had it in my head that they were like a one-way ticket to a diverticulitis flare-up.
Uh-huh.
Turns out I was totally falling for a myth.
It's amazing how much, misinformation is out there
Right.
about even common conditions like this.
Totally. And that's just one of the surprising things we're going to unpack today as we deep dive into all the information you sent us about diverticulosis.
Okay.
So we've got excerpts here from Diverticulosis Final L5.pdf, a document created by gastroenterologist Dr. Robert Fusco earlier this year. And it looks like you're aiming to get a really solid grasp on what diverticulosis is, what to watch out for, and how to manage it.
Exactly.
So are you ready to bust some myths and uncover some fascinating facts?
Absolutely. Let's dive in.
Perfect. Let's start with the basics. I think most people have heard of diverticulosis, but might be a little fuzzy on what it actually means.
Right.
Can you give us a quick anatomy lesson?
Sure. So, you know how your digestive system is basically this long tube that processes everything you eat?
Yeah.
Well, the colon is the last part of that journey. It's like the grand finale.
Okay.
Where the water and electrolytes get absorbed from the leftover waste.
Okay.
Turning it into solid stool.
Okay. So the colon's the MVP of waste management.
Yes.
Where do these diverticular things come in?
Imagine the colon wall as like an old tire's inner tube.
Okay.
Over time, especially if it's not well supported, and we'll get into why that happens, it can develop these weak spots. And those weak spots bulge outward, forming little pouches called diverticula.
The little pockets popping out of the colon wall.
Got it. And having these pouches is what we call diverticulosis. It's incredibly common, especially as we age. Think about the diverticular disease affects half of all people over 60.
Wow.
And it jumps to almost everyone over 80.
Wow. Those are some serious numbers.
Yeah.
You're telling me nearly everyone gets these pouches eventually? So why aren't we hearing more about it?
Well, that's the tricky part. Most people with diverticulosis have absolutely no symptoms.
Really?
It's often discovered just by accident during a colonoscopy or a CT scan.
So you could be walking around with these little pouches in your colon and have no clue.
That's right. But here's the distinction that often trips people up.
Okay.
Having the pouches is called diverticulosis.
Uh-huh.
When those pouches get inflamed or infected,
Okay.
that's when we call it diverticulitis.
Right.
And that's when you start experiencing symptoms.
Okay, so it's like the difference between having a predisposition to something and actually having the full-blown condition.
A perfect analogy.
Yeah.
And diverticulitis is definitely something you want to be aware of. It can cause anything from mild discomfort to more serious complications.
Speaking of discomfort, what kind of symptoms should people be on the lookout for?
Well, the most common symptom is abdominal pain.
Okay.
Usually on the lower left side where the sigmoid colon, the most common spot for diverticula is located.
Yeah.
This pain can be intermittent, kind of crampy, and sometimes accompanied by changes in bowel habits.
So like a stomach ache that comes and goes, but always in the same general area?
Exactly. Another symptom, though, less common, is rectal bleeding.
Okay.
It can be alarming to see bright red blood.
I bet.
But thankfully, it often stops on its own.
Yeah.
Of course, any bleeding warrants a call to your doctor.
Right.
Just to rule out other causes.
Right. Better safe than sorry.
Yeah.
Now, we've talked about how common diverticulosis is, especially in the U.S.
Yes.
Any theories on why it's so prevalent here?
There's a fascinating correlation with diet.
Okay.
Diverticulosis is much rarer in parts of the world, like rural Africa and India,
Interesting.
where diets are traditionally very high in fiber.
So you're saying our Western diet, which is notoriously low in fiber, could be a major culprit?
It's a leading theory.
Okay.
When you don't eat enough fiber, your stool is smaller and harder, and your colon has to work harder to push it through.
Yeah.
All that straining puts pressure on the colon wall, potentially weakening it, and making those diverticula more likely to form.
That makes sense. It's like trying to squeeze a thick milkshake through a thin straw. Not going to end well.
Great analogy.
Right.
And here's where your poppy seed fear comes in.
Okay.
There's this outdated idea that small, hard things, like seeds and nuts, could get stuck in the diverticula and cause problems.
The seed myth. I'm guessing that's not actually the case.
Nope. Totally debunked.
Right.
A large Harvard study actually found that people who frequently ate nuts and seeds had a 28% lower risk of diverticulitis and bleeding.
Wow. So I can enjoy my trail mix guilt-free. What a relief. But if it's not seeds causing the trouble, What actually triggers those pouches to become inflamed and turn into diverticulitis?
It's all about bacteria.
Okay.
Our colon is home to this huge community of bacteria, trillions of them,
Yeah.
which are generally good for us and help with digestion. But if the diverticulum gets weakened, those bacteria can seep through the colon wall and cause an infection. That's diverticulitis.
So it's like a breach in the fortress wall, letting the invaders in.
Yeah.
And when that happens, how serious can it get?
Diverticulitis runs the gamut from mild discomfort to pretty serious complications.
Okay.
Some people just have a bit of pain that's manageable at home, while others end up hospitalized.
It's quite a range. I'm guessing the treatment depends on the severity.
Absolutely. Doctors categorize diverticulitis as either uncomplicated or complicated.
Okay.
Uncomplicated means the infection is contained,
Uh-huh.
while complicated means it's spread beyond the colon wall,
Okay.
leading to things like abscesses, which are collections of pus,
Yeah.
or even perforations, which are holes in the colon.
Yikes. That sounds scary.
Yeah.
How do they figure out which type you have?
They'll consider your symptoms, do a physical exam,
Yeah.
run some blood tests, and maybe order a CT scan to get a clearer picture of what's going on.
Okay. So they gather all the intel before deciding on the best strategy.
Right.
Makes sense.
Yep.
Let's say it's uncomplicated diverticulitis. What's the treatment plan?
Well, the good news is uncomplicated cases are usually managed conservatively.
Okay.
Think bowel rest with a liquid or low-fiber diet to give your colon a break.
Right.
Plus a course of antibiotics to target the infection.
Okay.
This combo often does the trick, and surgery is rarely needed.
So basically, you're putting the colon on a little vacation while the antibiotics do their thing.
Exactly.
Okay. But what happens if it's complicated diverticulitis?
That's when things get more serious, often requiring hospitalization.
Right.
Intravenous antibiotics are usually the first line of defense.
Okay.
But depending on the specific complication, they might need to drain an abscess or even perform surgery to repair perforation.
It sounds like prevention is key here.
Yeah.
Is there anything people can do to lower their risk of developing diverticulitis in the first place?
There are definitely things you can control.
Okay.
And guess what tops the list?
I have a feeling I know the answer to this one. Fiber.
You got it. A high-fiber diet is your best weapon against diverticulitis. But it's not just about what you eat. It's about overall lifestyle choices.
But now I'm kind of curious to go deeper. Like, what's actually happening
Right.
at a cellular level when these pouches form?
Think of the colon wall like a sturdy,
Okay.
multi-layered brick wall.
Okay, and I'm picturing it.
Okay, each layer has a specific job
Uh-huh.
to keep things strong and flexible.
Okay. Walk me through these layers.
The innermost layer, the mucosa, is like the wallpaper.
Okay.
It's in direct contact with all the action, the stool, the bacteria,
Yeah.
everything passing through.
Right.
Its job is to absorb water and electrolytes.
So it's the first line of defense.
Exactly.
Hmm.
Then comes the submucosa,
Okay.
the support beams of our wall.
Okay.
It houses blood vessels, nerves, and lymphatic vessels
Okay.
that keep the mucosa nourished and functioning.
Makes sense. What's next?
Then we have the muscle,
Ah.
the muscularis propria.
Okay.
This layer is responsible for the contractions
Okay.
that propel waste along,
Right.
keeping things moving.
The engine of the operation.
Exactly. And finally, there's the serosa,
Oh.
the outer layer that acts as a protective covering,
Okay.
holding everything together.
So in diverticulosis, it's this wall that weakens, right?
Right. The muscularis propria, that muscle layer, is usually the culprit.
Okay.
Over time, it loses strength,
Okay.
and those weak spots bulge out, forming the pouches.
That's like the mortar between the bricks starts to crumble.
The perfect analogy.
Right.
And as we discussed, those bulges are prime real estate for inflammation
Right.
and infection. But you're probably wondering,
Yeah.
what causes this weakening in the first place? Is it just aging?
Well, I was about to blame my birthday cake,
Okay.
but you hinted that lifestyle plays a role too.
Absolutely. Remember those usual suspects, low fiber,
Huh?
lack of exercise,
Yep.
extra weight, and smoking? They all gang up on the colon wall.
Okay. Let's break it down. Low fiber. How does that wreak havoc?
Without enough, fiber stool becomes small and hard,
Okay.
making the colon work overtime to push it through.
Yeah.
All that straining puts extra stress on those muscle layers,
Right.
weakening them over time.
Makes sense. And I imagine lack of exercise and carrying extra weight don't help matters.
You're right. Lack of exercise slows down digestion,
Uh-huh.
contributing to constipation and more straining.
Yeah.
Extra weight adds pressure on the abdomen,
Okay.
stressing the colon even more.
So it's a combination of factors that slowly wear down those colon walls.
Yes.
But we also talked about genetics.
Yes.
If someone in your family has diverticulosis,
Right.
you're more likely to develop it. How does that fit in?
Great question. While the exact genes involved are still being investigated,
Right.
it seems some people inherit weaker connective tissue in their colon.
So they're starting with a slightly less sturdy wall to begin with.
Exactly. They might be more susceptible to developing diverticula.
Even with healthy lifestyle habits.
Right.
Understanding those genetic factors could be key to personalized prevention strategies in the future.
Personalized medicine for gut health.
It is pretty amazing. You know, we often pop pain relievers without a second thought, but really understanding how they affect our entire body is so important, especially for folks dealing with diverticulosis.
Absolutely. So the sources you shared, they specifically mention ibuprofen and naproxen.
Right.
I mean, Advil, Motrin, Aleve, those are like household names.
Oh, absolutely. Those are practically staples. And they actually all fall under the same category of drugs. They're called non-steroidal anti-inflammatory drugs.
Right.
Or NSAIDs for short.
Gotcha. Now, here's where things get kind of interesting. These medications, they're designed to reduce inflammation, right? But here's the kicker. They can actually cause inflammation in the digestive tract.
Okay, wait, so that seems kind of counterintuitive.
Sure.
You take something to reduce inflammation and it causes it somewhere else. What's going on there?
Yeah, it seems backwards, right? Well, to understand it, we need to look at how NSAIDs work. So they basically block the production of certain chemicals. These are called prostaglandins.
All right.
Think of them like little messengers running around in your body.
Okay.
Prostaglandins, they're involved in inflammation, but here's the key. They also protect the lining of your stomach and intestines.
Interesting.
So when NSAIDs block these prostaglandins, they can make your gut more vulnerable.
I see.
Like it can lead to irritation and inflammation down there.
Ah, okay. So with NSAIDs potentially causing inflammation in the gut, that obviously ties into diverticulitis.
Exactly.
Especially since the source material specifically mentioned an increased risk of attacks.
Yeah, and the connection is pretty clear. Remember, diverticulitis is when those little pouches, those diverticula in your digestive tract, get inflamed or infected. So if you already have these pouches, which is called diverticulosis, the added inflammation from NSAIDs can really make things worse.
Right, it's like
throwing gasoline on a fire.
Exactly. And the source material emphasized regular use. Why is that distinction so important?
That's a great point. You know, if you pop an ibuprofen once in a blue moon for a headache, you're probably fine.
Right.
But if you're taking these meds regularly, especially for chronic pain, then it becomes a concern.
Makes sense.
And in those cases, you really should talk to your doctor. There might be other ways to manage your pain that are safer in the long run.
Like what kind of alternatives?
Well, it depends on the person and the situation. But, you know, there's physical therapy, acupuncture, even topical pain relievers, things like that.
Gotcha. Now, there was one interesting exception in the sources. It mentioned low-dose aspirin, the kind people take for heart health. Why doesn't the same warning apply to that?
That's because low-dose aspirin, while technically an NSAID, it's mostly prescribed to prevent blood clots, not really for reducing inflammation.
So it works differently.
Yeah, it targets a different pathway in the body. Basically, it's a balancing act. The benefits of preventing a heart attack or stroke, especially for people with heart conditions, outweigh the small risk of gut irritation from that tiny dose.
So it's like a little bit of poison that is good for you.
Well, in a way, yeah.
It's fascinating, but I have to admit, it's kind of hard to wrap my head around that.
It is a bit paradoxical. The body is a complex thing.
Definitely. The sources also talked about Tylenol, or acetaminophen, as a potentially safer alternative. So if someone is concerned about these risks, is Tylenol a better option?
Absolutely. Tylenol is a much safer choice for people with diverticulosis.
Interesting. How come?
Well, it has to do with how it works. You see, Tylenol targets your brain to reduce pain and fever, but it doesn't mess with your stomach like NSAIDs do. It goes through a whole other mechanism, mainly focusing on the central nervous system without affecting those prostaglandins we talked about earlier.
So no gut irritation.
Exactly.
Okay, so just to recap. Regular use of NSAIDs, like ibuprofen and naproxen, can increase the risk of diverticulitis flare-ups. That's because of how they affect the digestive tract.
Right.
Tylenol is generally a safer alternative.
Yep.
And low-dose aspirin for heart health, that's usually okay.
Exactly.
But as always, talking to your doctor for personalized advice is the best thing to do.
Couldn't agree more. That's fascinating. What other research breakthroughs are you excited about?
Well, the role of the microbiome in diverticulosis is a hot topic.
Yeah, I was going to ask you about that. You've probably heard about this massive community of microbes
Yes.
living in our gut.
Trillions.
Yeah. Well, they're not just hitchhikers.
Right.
They play a crucial role in digestive health.
They do.
So these little guys have more power than we thought.
You bet. And imbalances in the microbiome are linked to all sorts of digestive issues.
Really?
Including diverticulitis.
How are scientists exploring this connection?
They're analyzing the gut microbiome of people with and without diverticulosis.
Okay.
They're looking for specific bacteria that might contribute to the disease
Okay.
or conversely protect against it.
So the goal is to manipulate the microbiome
Right.
to prevent or treat diverticulitis.
That's the hope.
It could involve personalized probiotics, diet changes, or even fecal microbiota transplantation.
Whoa.
Transferring stool from a healthy donor to someone with diverticulitis.
Fecal transplant. Now, that's commitment to gut health?
It might sound extreme,
Right.
but it's showing promise for many conditions, though it's still early days.
Yeah.
More research is needed.
It's incredible that something as tiny as bacteria can have such a huge impact on our health.
Right.
Speaking of small but mighty, let's get back to those seeds and nuts. I confess I've been avoiding them for years.
I hear you. The myth is persistent.
Right.
But why do you think this idea that seeds and nuts are harmful took hold?
Well, I guess it makes sense that if you have these little pouches in your colon, you wouldn't want anything getting stuck in there.
That's the theory. Doctors used to think undigested seeds found in the stool of people with diverticulitis meant they were causing the problem.
Like a tiny pebble lodging in a crack.
Right. But it turns out that's just not the case. Seeds and nuts don't actually get trapped.
Okay.
And there's no evidence they contribute to inflammation.
So another myth busted, science for the win. But what about the long-term outlook for people with diverticulosis?
Right.
Are those pouches just going to keep getting worse?
Well, the good news is, for most people,
Right.
diverticulosis doesn't necessarily worsen over time.
Really?
Many live long, healthy lives without any complications.
That's reassuring to hear.
It's not an inevitable downward spiral.
So it's all about managing it
Right.
to prevent those bouts of diverticulitis.
Exactly. And that's where lifestyle comes in.
Right.
The same things that help prevent diverticulosis also help keep it in check.
Okay.
A high-fiber diet, regular exercise, maintaining a healthy weight, and kicking those smoking habits to the curb.
Got it. And early detection is key if diverticulitis does strike.
Absolutely. The sooner it's caught, the better the outcome.
Right.
Early treatment with antibiotics can usually knock it out before it has a chance to spread.
This has been incredibly helpful. We've covered so much ground already.
Right.
But I'm sure our listeners have more questions. What are some things people should discuss with their doctor
Okay.
if they're concerned about diverticulosis? So first up, can you still enjoy your morning cup of coffee if you have diverticulosis?
Right.
There's this persistent idea that caffeine is a gut irritant. What's the real deal?
That's a great question. Good news for coffee lovers. Moderate consumption is generally considered safe.
Okay.
In fact, some studies suggest coffee might actually be beneficial for the digestive system.
Oh, really?
It's packed with antioxidants, and some research even points to it stimulating gut motility,
Okay.
which can help prevent constipation.
So coffee might actually help things move along smoothly. I like the sound of that. But what about alcohol? Is that a hard pass for folks with diverticulosis?
The advice on alcohol is similar to coffee. Moderation is key. The occasional glass of wine with dinner is unlikely to cause problems. However, excessive drinking can irritate the digestive tract
Right.
and potentially increase the risk of diverticulitis.
Okay. So everything in moderation.
Exactly.
Makes sense. Now, what about exercise?
Yes.
Is it safe to, work up a sweat?
Sure.
If you have diverticulosis, I can imagine some people might be worried about straining.
Actually, regular exercise is highly recommended for people with diverticulosis. It helps keep the digestive system moving,
Okay.
reducing constipation and straining. It also helps with weight management, which we know takes pressure off the abdomen.
Yeah.
And of course, exercise has overall health benefits.
Right.
Boosting the immune system and fighting inflammation, both important for managing diverticulosis.
So exercise, good for the gut, good for the body, good for the mind. What's not to love? Speaking of getting advice, what are the key things people should discuss with their doctor if they're concerned about diverticulosis?
First and foremost, be honest and open about any symptoms.
Okay.
Don't downplay abdominal pain changes in bowel habits or rectal bleeding.
Yeah.
It might feel awkward, but remember your doctor's there to help, and they need the full picture to make an accurate diagnosis and recommend the best course of action.
Right. No need to suffer in silence. What else is important to bring up?
Sharing your family history is crucial. If you have relatives with diverticulosis or other digestive conditions,
Yeah.
let your doctor know. And be sure to list all medications you're taking, both prescription and over-the-counter,
Right.
as some can impact diverticulitis risk.
So a complete medical history is key.
Yes.
Got it.
Yeah. Minimally invasive surgical techniques for diverticulitis are constantly being refined.
Okay.
Laparoscopic surgery is already standard, but surgeons are making it even less invasive with smaller incisions,
Wow.
faster recovery times, and fewer complications.
It's amazing how far medical technology has come. So while diverticulosis is common, it doesn't have to be a life sentence of worry and discomfort.
Absolutely. With new research and treatment options emerging all the time, there's plenty of reason for optimism.
This deep dive has been truly eye-opening. We've gone from anatomy basics to the cutting edge of gut science.
Right.
But before we sign off, any final words of wisdom for our listeners?
I think the biggest takeaway is that knowledge is power. By understanding diverticulosis, making healthy choices, and working with your healthcare provider, you can take control of your gut health and live a full and vibrant life.
Beautifully said. And remember, you don't have to navigate this alone. Reach out to your doctor, a registered dietitian, or check out reputable online resources like the American Gastroenterological Association.
Great advice.
And on that note, we wrap up our deep dive into diverticulosis.
Yes,
We hope this journey has been informative and empowering.
it has.
Remember, a healthy gut is a happy gut, and with the right knowledge and support, you can achieve both.
Absolutely.
And until next time, keep exploring, keep learning, and keep diving deep into the fascinating world of health and science.
Thank you for joining us.
See ya.